And now to other stories. Even in times of COVID-19, tuberculosis remains one of the deadliest infectious diseases in the world. The World Health Organization, WHO, and European Center for Disease Prevention and Control, ECDC, warned on World Tuberculosis Day on Thursday the drop in registered TB cases of 24% between 2019 and 2020 was presumably due to the pandemic affecting the diagnosis and reporting of the disease. They added that it remains the second most deadly infectious disease behind COVID-19. Now, joining me to shed more light on this is Dr. Tui Mebawandu. He is a public health practitioner, and he will be talking to us about this World Tuberculosis Day. Thank you so much for joining us, Dr. Tui.
Yeah, thank you for having me.
Now, today is World Tuberculosis Day. Let's begin by sharing or enlightening the public on what tuberculosis is.
Yes, today is World Tuberculosis Day. It's actually, a day set aside for us to remember when the disease was discovered by Koch, sometime in the 18th century. Now, what is the tuberculosis? It's an infection focusing mainly on the lungs. It's caused by a bacteria that then enters the lung system and can affect any organ. Now, about 9 countries that form the big body for tuberculosis, Nigeria is one of them. And actually, Nigeria is number 7 among the countries that form the big body of tuberculosis. Tuberculosis kills as much as more than 200,000 people every year. And then in Nigeria, we have as much as 300,000 unaccounted for tuberculosis cases. Identifying tuberculosis has been a challenge in Nigeria. Funding has been really challenging. We're not getting money to. And then, with the advent of HIV and COVID, tuberculosis has actually been killing more from 2020 up to now than it was in the past. We thought we were winning the war, but now, with shortage of funds, presence of COVID-19, and then diversion of funds to COVID-19, and then the prevalence of HIV/AIDS, we're seeing more of tuberculosis cases, especially the multi-drug resistant strain.
So who is at risk of tuberculosis?
Well, like I said, people with respiratory problems, okay? Do you have asthma? Do you have diabetes? Are you malnourished? A child also at risk, and an old person, extreme of ages, they are at risk. Presence of COVID-19, presence of malnutrition, and presence of HIV. These are clear-cut risks for tuberculosis. Then, if you are living in a place that is crowded, not properly ventilated, then the chance of spreading tuberculosis around is very high. So, these are some of the people that are at risk of tuberculosis. But tuberculosis is a respecter of nobody. Anybody can be infected, and then we should not assume that because this person is affluent that he cannot take tuberculosis. We have to actually, be on the watch out.
So how contagious is tuberculosis?
Yes, tuberculosis is contagious because a person with positive bacteria shedding the bacteria from the sputum or from the respiratory system can infect between 5 to 20 people.
That's huge.
In a short period of time. So you know what it means that big 100 tuberculosis, that you are missing at least 100 times 20. That's about 2,000 cases. So it's quite contagious, and then it's worse if there's overcrowding. It's worse if there's malnutrition. It's worse if people are not eating properly, and then they have diabetes, they have HIV, and then it's worse if people are not detecting it as appropriate as when necessary.
Well, let's look at the prevalence of tuberculosis in Nigeria. You already mentioned the fact that over 200,000 people die from this disease every year. And of course, that is also shown in the statistics that Nigeria comes third behind India and China in terms of tuberculosis cases. But about 590,000 new cases occur. Around 140,000 are also HIV positive. That's out of this 590,000. But looking at all of this, what can we do? What can be done to stem the tide of this disease?
The important thing to do in the case of the high burden of tuberculosis sharpen detection. I mean, because the most important is to find a way to improve the active case finding. Yeah, cases that are active, we have to find them. And then the way we find them, we have to involve everybody, the primary health center, health services, the private hospitals. Everybody must be, involved in the active case finding. Now, what we need to also do is to improve on our microscopy center that can help to detect more tuberculosis. I think since about 10 years, we're able to improve the laboratory services from about 3,900 to more than 6,000 now, which is nice. Then the gene expert, that's the testing. We've gone a bit off, maybe about 2 machines now all over Nigeria to pick tuberculosis. Now, the question is actually how far are we educating? We need to educate the people. Once you cough and your cough is lasting more than 2 weeks, you need to do a gene expert or do a microscopy. Then once you find that you are sweating a lot at night, you are losing weight unexpectedly, you have to actually find a way to check whether you have tuberculosis. The symptomatology are very clear. The thing is that it's access to those care, ability to pick the specimen, check people, and then receive treatment as appropriate as possible. And in this regard, it's very important for us to look for cases of multi-drug-resistant tuberculosis, which is even worse than whatever disease we can think of.
So what would you say is the level of awareness currently in Nigeria?
Well, the level of awareness depends on the part of Nigeria you are talking to. Some people they are aware, but Nigeria's system is driven mainly by superstition and magical thinking.
Sadly.
This is not my portion, and then they have witchcraft to blame for anything that happens. I think when you see a lot of these things, and in that of our healthcare system, we're not communicating enough. Honestly, we're not. We should be able to mainstream our communication to the churches, to the mosques, to the religious centers, to every function, to schools, so that we need to form TV club in schools to educate people. We need to also form it to our religious houses to educate people. And then we shouldn't leave TB communication to March 24 when you have the World TB Day. It should be an ongoing and continuous communication
enlightenment
to raise the awareness.
So in wrapping up, this year's theme is invest to end TB, save lives. How do we achieve this?
Yes, we achieve the ending of TB through some critical strategies. One, we need to increase the funding. There's a huge financial gap, because TB itself costs the world about $13 billion annually. So we need to actually, find a way to seek funding. Yes, the funding gap. What we'll be able to achieve that is about 63%, 65% from the partner, 5% from the government. We still have about 35 or so percentage unaccounted for in terms of funding. We need to do the funding. Secondly, we must make sure that we can do detection easily and promptly. Now, by improving the education, we have to put specimen, do our tests, and then access to drugs. Because there are constraining factors that can prevent people from accessing drugs. We need to address those things and intensify, completion of treatment. So these are very key.
Thank you so much. Thank you so much for the enlightenment, Dr. Tuyemi Bawodu, public health practitioner. Thank you for your time on the news.